Now I have the privilege of introducing another state, which happens to be one of the first state which I visited after I assumed the post of CMO at the time for tobacco control program. That is Uttar Pradesh. So Dr. Alok, we have known him for long. He is a government officer of the Uttar Pradesh Provincial Medical and Health Services in India, and a surgeon by training, and has a professional experience of about 31 years, and currently the Joint Director Health since 2014, managing the National Tobacco Control Program along with other NCD programs such as the NCD, the NPCDCS, the main NCD program, and also the elderly program and the palliative care as well. He is one of those leaders in tobacco control who also introduced Yellow Line campaign in 2018-19 for strengthening compliance of the CODPA section 4 and 6, and he is responsible for strict implementation of the anti-spitting during this COVID times regulation to fight against smokeless tobacco. So, Dr. Alok, the stage is yours now.
Now, I will give you a brief about the programs undertaken and the initiatives undertaken by the our state tobacco control cell to disseminate the various components of the anti-CP program throughout the state. And we instituted a robust framework for district, sub-district level, and capacity building of the district nodal officers, district consultants, and their training and sensitization, including the orientation of the various stakeholders of the other departments, with the coordinating with them and conducting their training workshops regularly. IEC material has been developed and disseminated throughout the state for this. Various legislative provisions like different notifications, circulars, and orders, they have been also issued from the empowered levels like highest level chief secretary, principal secretary, and secretary health, and director general of the UP, because the law enforcer had to be involved also for the enforcement of the various provisions of the tobacco control laws. As far as the yellow line concerned, I will give you a brief that we instituted this yellow line component throughout the state, and on the 2nd of the October in 2018, on the 125th of the resume. And then we have launched with this freedom from tobacco products campaign through Yellow Line campaign in Pan state. And here we ambitiously embarked upon the, including the mandated but also all the government establishments, maybe the government offices, training institutes, other schools, and whosoever is trying or included in the government program, all the government established have to be declared tobacco-free confines by the Yellow Line campaign. And till date, I would like to share that till date we could do cover these various government offices, including the educational institution. About 28,600 entities have been covered under the Yellow Line campaign, and we have so that each of the government office, their head of departments have to satisfy themselves and then declare their institution tobacco free and covered with the Yellow Line campaign. And ultimately, after the line listing of all the government departments, the district district magistrate, including all the district nodal officers, they have to make a little small function and declare the state tobacco free. Till date in the UP, out of the 75 districts, more than 46 districts had declared all the government establishments tobacco free and covered with the Yellow Line campaign. This Yellow Line campaign has been taken notice by the WHO as well. This is the some pics during the launching of the last year's 31st May WNTD, and we have launched it massively throughout the state, and to give an impetus to the existing yellow line program, as well as the coverage of all the government institutions for the tobacco free section 4 and section 6 compliance. These are the various certificates issued by the different districts. I want to share this. Now the way forward, as per this year's tobacco WNTD program, I would like to give certain my inputs that the smokeless tobacco has been a menace for the northern states, especially UP and Bihar. And as per the COVID-19 pandemic that is continuing in the whole of the world, we have issued letters from the Chief Secretary level at the DG level and the Principal Secretary Health level to combat this spitting and consumption of the tobacco products as well as the pan masala. In my opinion, along with the smokeless tobacco, pan masala should also be banned, because as soon as one chews anything from the pan masala or the tobacco, this salivation urges him to spit on and on. So this should be banned, and we should think upon it and come out a comprehensive ban on this tobacco as well as the arecanut or containing or the pan masala, which have been publicized and promoted by the companies very effectively in media and social media. Thank you. इसको sharing बंद करना, internet का issue है. Thank you for letting me present this thing.
Thank you, Dr. Alok. Thank you very much for the presentation. Dr. Alok is very right. Apart from the SLTs, the arecanut preparations, including pan masala, induces the person's body, the salivary glands in the body, to increase the salivation to about 300 times. So you have no other way but to spit it out. And that during COVID times is very relevant. And I agree with what Dr. Alok has just said. Thank you very much, Dr. Alok.
Thank you, Dr. Charan. And there were some issues with the connectivity issues, and I regret for those.
No issues, sir. No issues.
Thank you. Thank you.